Hi students, welcome back to my channel. In the previous lecture, we have discussed border molding procedures in detail, and today I am going to teach you how to make the final impressions and creating the definitive cast. So let's begin. Master impression is one of the most important steps in the fabrication of a complete denture. It should record the denture bearing area at rest to reproduce the final details. And it should also record the muscular peripheral tissues in function. So after border molding procedures, the tray should be prepared before making the final impression. And how it happens, that is how to prepare the tray before final impression. If a custom tray with spacer was used, then the wax spacer is removed to provide some space for the impression material. 0.5 to 1 mm tracing material is removed. Here in this picture and this picture it shows the up to 1 mm tracing compound or tracing material is reduced using a BP blade or a scalpel. Okay. So a scalpel blade is used for the green stick compound, and for polyether impression material, that is elastomeric impression materials, a burr or a scalpel is used. And thickness of the flanges and border should be 2.5 to 3 mm. Here these are the pictures showing trimmed maxillary and mandibular trim. Okay. The material over the posterior palatal seal area is not removed because there are three reasons. Which are they? It enhances the seal, that is posterior palatal seal, by slightly displacing the tissues. It guides the positioning of the tray, and also it prevents the aspiration, that is excess material, from going to the throat. So these are the three reasons why the material over the posterior palatal seal is not removed. The holes are drilled on the impression tray to allow the escapement of the impression material, and the holes are placed in the mid-palatine raphe, anterolateral and posterolateral regions of the hard palate and the residual ridge region. And these holes will prevent tissue displacement during the impression making. Here the relief wax removed from the impression tray, creating a relief chamber in the area. And noted that all the sharp edges have been rounded. And 5 relief holes have been prepared using a number 8 round burr. So round burr, it is used for providing the holes. Okay. So what is the next step? Making of the master or wash impression. Here the impression material chosen should be of low viscosity. Why low viscosity impression materials are used for this procedure? Because it is to record the structures accurately. So for recording of the structures accurately, we will use the low viscosity impression materials. Okay. And the amount of material which is loaded onto the tray should be able to form a uniform and thin layer. What will happen if loading an excess material onto the tray? It will lead to an overextended impression. So the material loaded onto the tray should be uniform and thin layer. And the material of choice for a secondary impression are zinc oxide eugenol impression paste, medium bodied or light bodied elastomeric impression materials. Okay. About the selection of a material. When there are any gross tissue undercuts are exist, elastomeric impression materials are indicated. And when using a custom tray with relief, that is close fitting tray, zinc oxide eugenol impression paste is preferred. And when custom tray with spacer is used, then medium or regular body or monophase impression material is preferred. And when using a custom tray with window, that is used for the displaceable tissues, impression plaster is used for that tissues in combination with the zinc oxide eugenol paste. Light body elastomeric impression can also be used to record the flabby tissues in combination with the medium body materials. For recording the mucosal contours, there are many materials which are suitable. Vinyl polysiloxane materials, they produce accurate impressions of mucosal contours and they are available in three main consistencies, which are they? Heavy, medium and light consistencies. So viscosity of material which determine how it is used. However, light consistency is suitable for the mucosal impressions in both maxillary and mandibular trays. These are the completed mandibular final impressions. Here this is using regular bodied elastomeric impression material and this is zinc oxide eugenol impression paste. So the correct position of the tray is very essential for making the impression. If the zinc oxide eugenol is used, then the patient's lips and some part of the face is covered with the Vaseline as the material is sticky and will be hard to remove. And then the impression material is mixed and evenly loaded onto the tray, covering the borders also. Then the procedure is performed and also the border molding movements should be performed simultaneously on all the sections, both passively and actively. And once this is done, the material is allowed to set with the patient's tongue touching the upper lip. And after the material is set, the tray is removed and inspected for any voids or deficiencies. So here this is the wash impression, okay, or the final impression. Here the tray is rotated and inserted into the mouth and asking the patient to lift the tongue slightly and centering it anteriorly. Index fingers of each hand is placed on the auxiliary posterior handles to apply gentle downward pressure such that the buccal flanges come in contact with the buccal shelf. And what about the final impression in maxillary? All the procedures are similar to that on the mandibular impressions. So here after placing the material evenly on the tray and around the borders, tray is inserted by centering and aligning the labial notch in the tray with the labial frame. Here the index fingers of each hand are used to apply an upward pressure in the molar region until the tray seats posteriorly in the hamular notches. Then tray is held in position with a finger in the hard palate just anterior to the PPSA. Border molding movements performed similarly in the both the passively and actively. The material is allowed to set and remove and inspected for any discrepancy. This is the completed maxillary final impression using here medium or regular body impression material and this is zinc oxide eugenol impression paste. This is the final impression using custom tray with window. This is the window which is used for a flabby or displaceable tissues. Here custom tray with window in the displaceable area. Here also border molding procedures are performed and they are completed previously with green stick low fusing impression compound. Then a final impression is made with the zinc oxide eugenol impression paste. Then tray is inserted and the impression plaster is injected onto the window. And this is the final impression using the custom tray with window. Here, the impression plaster is syringed onto the tissue. Okay, this window. Here, the impression plaster is injected. Following the setting of the plaster, then the tray is removed after the plaster sets. And the master cast is poured after applying appropriate separating medium on the plaster. Then the impression is recorded with the displaceable tissues with the minimal pressure, while controlled pressure is transferred to the other areas with a close fitting tray and impression with the zinc oxide eugenol paste. And alternately, impression for flabby ridges also accomplished using a combination of medium body elastomeric impression material and light body elastomeric impression material. This is the completed final impression using light body for a flabby tissue and medium body for the remaining tissues. Okay. And using stock trays, they are more used frequently for a maxillary impressions than for the mandible. And it is indicated for ideal ridge conditions when patient does not have the time for the additional impression procedures. So there are only two conditions. That is, first one is the ideal ridge conditions, or second one is when patient does not have any time for additional impression procedures. An appropriate stock tray is selected. It is very important and for ensuring the adequate support for the borders. And also it may be modified using base plate wax if needed. And the preliminary impression is made using putty in elastomeric impression material or tray compound material, and the putty material which requires a tray adhesive. Then the borders of the impression are reduced by 0.5 mm and the final wash impression is made. If a putty material is used, then the light body impression material is used, and if impression compound is used for the primary impression, then secondary impression zinc oxide eugenol paste is used. So this is the final wash impression made with the light body material. If a compound impression is used, then compound can be separated from the stock tray and used as a custom tray while the borders are refined. During both preliminary and final impression procedures, simultaneous technique of border molding is performed. And then last one, that is using record bases with the occlusal rims. This is indicated for atrophic ridges and this condition is more common in the edentulous mandibles. And here functional closed mouth impression is made using tissue conditioning materials. And then an anatomic open mouth wash impression is made using light body impression materials. And record base with occlusal rims are fabricated on the maxillary final impression and mandibular preliminary impression. The occlusal rims are inserted intraorally and modified to appropriate the appropriate vertical dimension. And the wash impression is made with mouth open using standard border molding methods, and the cast is poured immediately and the procedure takes up a lot of clinical time. This picture shows the final impression, reveals the excellent capture of the anatomy of posterior palatal seal area. This is the posterior palatal seal area. Okay, this is the hamular notch, and here it shows the excellent capture of this anatomy. But here the area of the wax spacer, here in this picture, here the area of the wax spacer is there. It shows there is no pressure. Okay, but the left maxillary ridge has the excessive pressure. And finally, after the delivery of this denture, uh, the decision was to relieve the denture using pressure indicator paste. Okay. What are the steps? Beading and boxing, pouring of the cast, indexing the cast. The final impression should be poured accurately, preserving the depth and width of the border tissues. And it is poured using dental stone. And the cast which is obtained, it is termed as master cast or definitive cast. So that is about the creating of the master cast. So final impression taken, it should be poured which is accurately with a dental stone, and the cast obtained is known as definitive cast or master cast. And the wash impression or secondary impression is the final impression. Okay. Coming to beading and boxing. Beading wax is available in round or square strips of various sizes. So these are the beading waxes. What is this beading? Actually, beading, it preserves the depth and width of the sulcus, and boxing produces the desired form and size of the base of the cast. So this is the beading of the maxillary impression using the beading wax, and this is for the mandibular impression. Here the tongue space is covered with the base plate wax. Okay, so beading preserves depth and width of the sulcus, and boxing produces the desired form and size of the base of the cast. Here this is the beading using base plate wax, 3 to 4 mm below, parallel and horizontal to the impression borders. This is maxillary and this is mandibular. And they are stabilized on a tabletop using the tray handles and modeling clay such that the ridges are parallel to the floor. This is important. Okay, ridges are parallel to the floor. Here the beading wax is placed 3 to 4 mm below to the impression borders, and it placed parallel and horizontal to the borders. Okay, and also the ridges are parallel to the floor. And coming to the boxing, so after beading, then move on to the boxing. This is the procedure known as boxing. Boxing with wax all around the beading, and the height should be 10 to 15 mm from the highest point in the impression. This is 10 to 15 mm. Height should be there. Okay, this is called a boxing. Boxing of the impression, then this is called the beading of the impression. And this is the boxing of the impression. And this is the boxing of an impression with strip rope wax. Here this is the rope wax, and after that sheet boxing wax. And this creates a wall to confine the stone and create strength along the border of the cast. This is the play dough which is used to form the beading for this mandibular impression. Note that the borders of the impression are at least 2 mm above the play dough. And here the boxing wax is positioned around the material, and it is sealed. Here it is sealed to minimize the loss of dental stone during the pouring of the impression. And this is the problem, causes and solutions for the wax boxing method. And finally, creating the master cast. The acceptable master cast should be of proper thickness, bubble free and void free, and it include accurate representation of all the impressed tissue surfaces and surrounding finished borders known as land areas. These are the surrounding finished borders. It is called as land areas, and these are the examples for void free or finished master cast. So what is a definitive cast? It is actually a replica of the tooth surfaces, residual ridge areas or other parts of the dental arch or facial structures used to fabricate a dental restoration or a prosthesis. And it is also called as final cast. So that is about the definition of a definitive cast. This is the shape of an average posterior palatal seal area. Here, this is the shape. Here, this is the black line. Okay, not at this is the black line. It indicating the vibrating line, posterior vibrating line, and it is the most distal extent of both the posterior palatal seal area and also the complete denture. This green area, which represents the area of the hard palate that often has soft tissue that can be compressed approximately 5 mm. This orange area, it indicates tissue that generally be compressed approximately 1 mm. And the degree of compressible tissue varies with each patient and must be determined intraorally. Stone will be removed from the master cast in this shape and depth as a laboratory procedure ending in a feather edge in the anterior. Okay. And this is the completed maxillary final impression with the outline of the posterior palatal seal area, which is drawn on the impression with an indelible marker. And this posterior palatal seal area will extend approximately 2 mm through the hamular notches. Then these are the definitive cast. So, pouring of the definitive cast, which is using dented stone. The mix is vibrated and poured into one posterior end of the boxed impression and allowed to flow onto the other. And this is continued until the boxed impression is full. And stone is allowed to set for 45 minutes and then it is separated. Then we get the definitive cast. Okay. So this is the master cast after the initial pour of the master cast. Here the crest of the ridges, which is not parallel to the bottom of the base of the cast, following the initial pour of the master cast. Okay. So prior to trimming the sides or of the base of the cast, the bottom is trimmed in order to achieve an acceptable thickness and make the ridges parallel to the bottom of the base. Here, this is the thinnest portion of the cast is in the vestibule. The minimum thickness of the master cast should be 12 to 15 mm in the thinnest area. This is the thinnest area and here it is 12 to 15 mm. Okay. And once all trimming has been completed on this model trimmer and cast has been allowed to dry and the land areas can be properly trimmed. And these land areas should be trimmed so that the vestibules are not more than 3 mm in depth. And these are the examples of well-shaped and finished maxillary and mandibular cast. So these are the definitive cast. Here this is 1 centimeter and the boxing that is height is 1 centimeter and width or the thickness which is 2 mm. Okay. And this table shows the problem, causes and solution for pouring of the cast. Finally, the impressions should be inspected for any air inclusions or voids and the surface is inspected to make sure that all the landmarks are recorded accurately. Small voids can be rectified by filling with wax. And finally, the impression should be disinfected by immersing in iodophor or 2% glutaraldehyde for 10 minutes. Here it shows the indexing of the cast. So next step is the indexing of the cast. Here it shows the 3 types of indexing. First one, placing grooves in the cast. Okay. Here using metal remounting plates and here by notching cast. And the cast must be reduced in size to fit within the confines of the denture flask. Here it is a groove which is placed perpendicular to first groove and intersecting approximately in center of the cast. In this picture it shows the placing the groove directly opposite thickest area of the cast, and it is parallel to the ridges also. Because of the deep lingual flanges and mandibular impressions which produce thin areas in the cast. And breakage of these thin areas can be avoided by placing such grooves. And the notches can be placed at widely separated points on cast with lathe mounted wheel or sharp knife. This table shows the problem, causes and solutions for the indexing of the cast. And this is the picture showing the groove indexing in maxillary and mandibular cast. This is the V-shaped notch indexing. Here, this is the V-shaped notch indexing on the cast. What are the reasons for errors in the impression? It is actually a common occurrence in the clinical practice. And most common reason is that improper positioning of the impression tray. If the tray placement is improper, the flange of the impression which lies on the side of deviation will be excessively thick, and flange of the impression opposite to the deviation will be thin. And other reasons are large voids, improper consistency of the impression material, movement of the tray during the setting of the impression material, inadequate scraping of the border molding material, and the quantity of the impression material, that is using too much or too little impression material is used. And these are the reasons for remaking the impressions: incorrect tray position in the mouth, pressure areas in the secondary stress bearing areas, any void or discrepancy too large to accurately correct, incorrect border formation as a result of incorrect border length of the tray, incorrect consistency of the final impression material when the tray was positioned in the mouth, and distortion of the impression material because of movement of the tray during setting of the final impression material. And in my lecture, I have discussed various methods of beading of an impression, boxing of an impression, then indexing of cast, then the various techniques for trimming the cast, and also the preparation of a master cast. And a properly boxed, poured and trimmed cast is essential for a successful restoration. And these are my references. And that's all for today's lecture. Please do like, share and subscribe my channel for more videos. And thanks for watching.